Good afternoon, good morning, and good evening to everyone in different time zones who are with us in today's webinar entitled Who Cares? A Look at DFI Lending for COVID-19. And this webinar is jointly organized by NGO Forum on ADB, Coalition for Human Rights and Development, and the International Accountability Project. I am Carlo from the International Accountability Project, and I will be your facilitator in today's webinar. This online session is first of a series, as we will also be organizing similar learning sessions in other regions. And we're happy to pilot this discussion in Asia Pacific region. And today, we will hear three analyses for IFI projects in the Philippines, Bangladesh, and India that are part of the Asian Development Bank's COVID-19 Active Response and Expenditure Support Program, or CARES. We, the civil society organizations, together with our communities, find ourselves left in the dark with regard to how much our governments have secured funds from IFIs, under what terms and conditions, and how these funds were used to contribute to the desired impacts on public health and social welfare. But before we proceed with the discussions from our resource speakers, I would like to present some context on this initiative. So basically, it has been nearly 2 years since the World Health Organization deemed COVID-19 a global pandemic. And since then, various international financial institutions have earmarked billions of dollars to for COVID-19 response and its associated social and economic crisis. Yet there is a concern about lack of transparency and accountability on how these funds were spent and what impacts the response has had. To address transparency gaps, civil society groups and researchers around the world are investigating the roles of IFIs in their nation's COVID-19 response. And with the support of the Response and Vision Fund of the Forge group of funders and by groups working with the early warning system, case studies were developed by partners and members of the Coalition for Human Rights and Development. And this work has been made in collaboration with partners such as the Arab Watch Coalition in MENA, Women in Africa, DAR in Latin America, NGO Forum on ADB, and the International Accountability Project. Next slide, please. Since there are funds coming in from various IFIs, we saw the need to track these projects that are approved with little information. And we developed the one that you're seeing in the screen. This is the COVID-19 DFI tracker, and this is how it looks like. So basically, it contains information about the funds received by public or private entities, what sector, how much funds are implemented for a specific project, and etc. So that's how the tracker looks like in our website. Next slide, please. So the COVID-19 tracker was created to respond to the inconsistencies and gaps in the disclosure practices of 15 development finance institutions. And this tracker is updated twice a month with new projects. Based from our monitoring from last year of January 1st until December 11 of this year, we have monitored over 1,500 projects funded by 15 development banks as their response to COVID-19 pandemic. And the COVID-19 tracker captures the information that we have online that contains actually the term or words COVID, pandemic, coronavirus in their title, project description, or rationale in the project documents. However, the 1,500 known projects that we track are just the minimum because we are still experiencing difficulties in tracking projects related to COVID-19. Next, please. Um, Also, in some cases where existing projects are repurposed or reallocated to COVID-19 response, we manually put that in the tracker. So it's not automatically scraped by our system. And these are some of the projects that we identified that were repurposed and reallocated, some in Latin America, in South Africa, and in Myanmar. Um, when you look at the tracker, later on you can see it. We will provide the link. When you look at the tracker, you'll find an interactive map that that um, that contains information per country or per region. No, also the data actually from that interactive map come from the early warning system. So next, please. Next slide, please. So this is how this is how you can explore the tracker. So you can use different filters like country and region. Well, the map, when you go to the link and when you go to the tracker, you can click on the map, the country, and then the data will be produced. And then if you want to use by region, the menu, the top menu, you can see the cluster per region. So that's how you use the filters in the tracker. Next, please. So we are happy to share with you the links for this for all the materials, this tool for you to explore and navigate. And in fact, the methodology that this tracker has was already translated into various languages for our partners to implement it easily and they can use it easily. And right now, the COVID-19 tracker has 12,000 views. So we invite and encourage everyone to make use of this tool for your advocacy and campaign work. Yes, please. Next slide, please. So basically, this is a slide. Next, please. In relation to East Asia Pacific, these are the trends that we monitor and we observe. Next, please. This one is in South Asia. That includes, of course, Bangladesh and India. Next, please. And this is the trend that we monitored. So I will not touch on this portion because I believe our speaker will elaborate more on this. But we can see from the experience of the Philippines, Bangladesh, and India, majority of the funds or projects went to the public or the government. However, there are direct links that the private sector has benefited from it through financial intermediaries or direct support for private sector recovery. So next slide, please. To end, we reiterate our concerns, urging the need for human rights-based approach in COVID-19 response, notwithstanding the fact that human rights violations are still happening amidst the pandemic. Next, the alarming lack of transparency and accountability on the use of funds. And right now, since we are in the online format of everything, so it actually opened up some opportunities for engagement. However, there are also excluded, and some folks are excluded and made obtaining information from governments more difficult. So next slide, please. So these are the links that we have for you. You can share this material and these links, especially the COVID tracker, so you can explore this tool for your work. So thank you. So let us now proceed with our first speaker. Our first speaker will discuss about the context or roles of DFIs in health sector and debt crisis. She is an associate professor in politics At the University of Wollongong in Australia, she lectures in the areas of development, international politics, and political economy. She has co-authored a book with A.R. Buzz Bowers on the global architecture of multilateral development banks, a system of debt or development, a 2010 book on the World Bank in Southeast Asia, and over 30 journal articles and chapters. She is currently researching multilateral development finance, development cooperation between the nations of the global south, the role of emotions in the development, in particular in sanitation and microfinance, and teaching and learning in international studies. She worked in the government, community, and aid sectors before becoming an academic. She has volunteered with Indigo Foundation, a nonprofit community development NGO, since 2002. Let us all welcome Dr. Susan Engel.
Thank you, Carlo. It's so lovely to be here. Could you also open up my slides, please? So I'm going to, just while Jen's getting that set up, I'm going to talk a little bit about some of the broader context that Carlo's touched on in terms of particularly what the multilateral development banks, the scale of their lending. I'll focus in on the Asian Development Bank, and then talk a little bit about the health sector lending from some research that I've done as well. So hopefully there'll be a little bit of overlap too with Vidya's presentation in a minute. If we could go on to the next slide, that would be great. So here's some data, a little bit similar to Carlo's points, but you can see the relative scale of World Bank Group lending. They're aiming for 157 billion in the 15 months, I think it's a 15 months to July actually, which was a 60% increase on the 15 months prior to the pandemic. One of the, I guess, positive sides of that is the relatively high allocation to the bank's most concessional arm, the International Development Association, with about a bit over 53 billion of that 157 billion. But when you go down from that, you see the bank's private sector lending arm is being allocated a huge proportion of the response, and that's quite a change and very much reflects, I think, David Malpass's private sector lending agenda and the billions to trillions agenda of Kim Young Jim before him. The development banks have also been doing a lot of co-lending. The AIIB, its COVID-19 crisis response facility, they're aiming to get 13 billion between April 2020 and April 2022. And they've been doing quite a lot of co-lending, like for example, with the World Bank in India, that was quite common, but also with the Asian Development Bank. So sometimes if you're looking for information about AIIB loans, they're not disclosing a lot, but they're co-financing loans that you might get more information from on the World Bank or the Asian Development Bank site. The New Development Bank is also aiming for $10 billion under its COVID program, and the Asian Development Bank, the CARES program, that's our focus today, 20 billion in that, and a further 9 billion in the vaccine facility. The World Bank focus is supposedly targeting the health emergency, strengthened health systems, protecting the poor and vulnerable, supporting businesses, creating jobs, and promoting a green, resilient, and inclusive recovery. Next slide, please. This is the Adb Cares Program, and so that $20 billion includes just 2.5 billion in concessional financing and 2 billion earmarked for the private sector. So both elements way less than the World Bank's equivalent kind of operations. You can see from the data here that Southeast Asia has been the biggest beneficiary so far with 8.5 billion. This is ADB data, by the way, not IAP data, which I probably should have used. So sorry about that, team. But it's the most up to date from them. So by region, Southeast Asia, South Asia, Central and West Asia, and then way down the scale there, the Pacific and East Asia. And you can see in terms of modalities, loans dominating, but guarantees at getting on towards 5 billion. That's fairly large, but just $500 million in grants. What I think is most interesting about the Adb Cares is the relative lack of focus on health. I think that reflects its historical limited engagement in the health sector. So just 1.72 billion directed specifically to health, contrasted to over 12 billion to public sector management and 6 billion to finance. Just following on from Carlo's points about the big concerns about these loan programs, as he pointed out, the first two issues are really the lack of accountability and transparency. The rapid rollout of the funds meant a lot of this loan documentation has been fairly thin. And so there's some issues there. But there's a few extra points I'd add. One is that I think there's big questions about whether the Adb Cares and other DFI lending is sufficiently pro-poor and gender sensitive, and whether the livelihood support that is going out has too much conditionality. And finally, on debt issues, and I think Hassan, that's a particular focus of his work on Bangladesh, how debt levels are constraining the response of countries in the global south. And then, of course, the MDB lending, the development finance lending will expand and exacerbate debt problems, and that debt will only further constrain the policy space for governments. In contrast, crises are always a boon for development banks. So, their lending goes up dramatically, and that's a boon for their flow-on programs for the next number of years. Next slide, please. So, I've done some research for Jubilee Australia with Nadine, who's organised today. Thank you, Nadine, and Owen Williams. And I've also done some research that'll be coming out shortly for Public Service International. Most of this is focused on healthcare. The PSI research is on the Indian context, and the Jubilee research we did was on Indonesia and Sri Lanka. And I'd say that what it shows overall really in terms of healthcare is that decades of the neoliberal thinking applied to healthcare has left quite an emaciated public health system in the global south that are generally really ill-suited for responding to pandemics. And what I've outlined in this slide here, but I didn't want to go through in any depth, was just what I think are some of the key phases in how that neoliberal agenda was applied to the healthcare sector through corporatization, the introduction of private providers, segmenting the healthcare market and segmenting and privatizing segments of the healthcare sector, the health insurance, and just the overall transfer of responsibility. So turning specifically to the COVID loans, and next slide, please, is that there's been some research on the International Financial Institutions response to COVID-19 that said that it's a continuation of using crisis as an opportunity to push through reforms, like, in the sense of Naomi Klein's shock doctrine thesis. What I think we've seen in the healthcare sector is really not so much that crisis as an opportunity for new reforms, but what's equally concerning are very much business as usual, some further privatisation, but a business as usual continuation of the already neoliberalised healthcare agenda. So the next point, I think, is that the overall response in healthcare simply hasn't been strong enough. And you see that with the Adb Cares priorities, that healthcare really, for example, wasn't even high enough on that list. The policies from the development banks just favoured continued commercialisation and privatisation of healthcare. And that's despite the fact that there's so much evidence now about the failures of privatisation in healthcare, that it's basically more expensive and less effective than public healthcare. But despite that, in the midst of a crisis, the development banks have continued their agenda of promotion of an increasingly privatised healthcare sector. Bank loans are seemingly going mostly to, development bank loans are seemingly going mostly to the government. But because in so many countries in the global south and in some in the global north as well, that the healthcare sector is so privatised, the loans are flowing through to the private health sector. They have to in order to have enough beds to respond to the crisis. So, so we know that those loans are going both directly to private providers and indirectly. And some of those private providers have needed the finance to keep them afloat because the pandemic was in fact a challenge to the privatised healthcare model. People were cutting back on elective surgery and non-urgent surgery. And so it's really challenged the private provider profits. Some of private providers have needed support from governments and from development finance institutions to keep them afloat. And that's particularly something we talk about in the paper with Nadine and Owen for Jubilee Australia. At the same time, the loans don't address the many failures of private providers in the wake of the crisis, that they've been price gouging, they've provided often poor standards of care, or they've refused to treat the poorest patients or those from the lowest caste or class, etc. The high levels of funding for the International Finance Corporation, and in particular in the World Bank, are of concern because, like mainstream bank loans, there's no conditions to ensure that those private firms getting support treat the poor and the vulnerable to ensure that those groups have access. The IFC have also been making lots of investments and loans in the healthcare sector to financial intermediaries and investment funds. And as you all know, those are even less transparent than normal bank lending. It's really hard to track when they're investing into investment funds that will fund the private healthcare sector. Finding where that money went is really difficult. So what we're seeing overall is really an expansion of healthcare financialisation, but through this business as usual sense. I think one of the other conclusions I take out of the COVID loans and the COVID pandemic is that health insurance has often proved useless in this context. This is because, particularly for rural people who don't have access to private providers within a reasonable period, for example, or in urban areas where private providers will prioritise those with more resources. And the insurance-based universal healthcare models where it's operating still leaves people with large debts. And those out-of-pocket expenses are one of the key forces pushing people back into poverty or into poverty for the first time in the COVID context. There's been inadequate attention to the pandemic on the inequality in healthcare access based on location, class, caste, gender, and so on. And that is a really big failure of the MDBs in this area, I would say. So my final point is I just think there's a neoliberal meta-narrative going on here that perhaps, if anything, was reinforced by the crisis. That, you know, I'm quite interested in the literature on how we make decisions, our decision-making processes and heuristics. I think what we see is that the experts just relied on in the development banks, relied on their standard ways of thinking about healthcare. And even though it was manifestly inadequate in the wake of the pandemic, and we see that with the lending. And that's it for me. Thank you.
Thank you very much, Dr. Susan Engel. Indeed, this pandemic only exposes, the business and as usual neoliberal push on public health system and promotion increasingly privatize the healthcare system. So thank you very much for your insights. Now let's move on to the next speaker to begin the discussion on country case study. Let me introduce our next speaker. He is a professor emeritus and former dean of the School of Labor and Industrial Relations at the University of the Philippines. He has a certificate in development economics, an MA in industrial relations, and a PhD in Philippine studies on labor and economy. He served as Undersecretary for Labor Relations of the Department of Labor and Employment in 1997 to 1998 at the height of the Asian financial crisis. Our next speaker to present the Philippine study is Dr. Rene Ofroneo of Freedom from Debt Coalition, Philippines.
Good afternoon, everyone. Good morning, wherever you are. The presentation of Susan is a very good description of what's happening in the Philippines. And I can tell you, Susan, you're spot on. Now, my presentation, I have a very short presentation focusing more on the framework used by the Adb in implementing its CARES program. There, can you see it?
Yes, po.
Yes.
Yeah, okay.
Yes,
But I don't know how to make this large. There, you have this slideshow.
Yes, po.
It's not there. You see, okay, successful. Anyway, sorry, let me start with now, we all know that this COVID pandemic shook Asia to the core, and there are many, some countries have not yet recovered, especially the Philippines, which experienced a shrinking of its GDP by almost 10% in 2020. It's a crisis like no other. But the point is, this COVID pandemic was also an opportunity for the Asian Development Bank, which was proudly parading and proclaiming its strategy 2030 for the Adb to promote its sustainability program. You see, as a backgrounder, Adb launched in 2018 is Strategy 2030, guided by two UN agreements, 2015. One is the Paris Agreement on limiting global warming to 1.5 to 2.0 degrees Celsius above pre-industrial era. I think everybody knows this. The other one is the Sustainable Development Goals of 17 in all. And there's so many targets under each goal, but essentially some of the major goals are zero poverty by 2030, zero hunger, of course, good health and well-being, quality education, And for those in the trade unions, their favorite SDG is decent work and economic growth, and well, and so on. I will not go into the detail of this. Let me see. Yes. Now, overall, the ADB's strategy 2030 talks about its vision mission to achieve a prosperous, inclusive, resilient, and sustainable Asia and the Pacific, while sustaining its efforts to eradicate extreme poverty. Wonderful. But how to fulfill this vision mission? Naturally, a good starting point would be to align its lending, the bank's lending program in support of the 17 SDGs and various targets under this SDG family. And second, align with the Paris Agreement 2015, which means greening Asia Pacific, foremost of which would be the phasing out of fossil fuels across the continent. Now, with the COVID pandemic, what was the ADB's response? Well, first of all, it was the ADB's response was amazingly quick. You see, second week of March 2020, WHO declared COVID as a global pandemic. The following week, the ADB set aside $6.5 billion as special fund for COVID assistance. Then in April 2020, it expanded this into 20 billion COVID-19 active response and expenditure support, CARES. So as I mentioned by Susan. And then within April, the 4 most populous countries in Asia outside of China were given these CARES loans. India, Indonesia, Philippines, $1.5 billion each, and Bangladesh, $500 million. By the end of 2020, the ADB added this $9 billion access vaccination program. And then, and of course, in between, there's ADB was giving some grants and technical assistance for food aid, procurement of some health materials, and so on. So overall, in 2020, 40% of ADB spending for DMCs, developing member countries, for 2020 went to COVID-related program. Now, what are CARES loans? They are a deviation from the usual loans. These are not project loans. These are general budgetary support or supplement, and mainly to for the following purposes: to help the governments in this containment program of the COVID, mainly health-related, social amelioration to the vulnerables, assistance to failing industries, especially micro, small, medium enterprises, stabilization of the financial system. Now, can anybody be against the above? I don't think so. Now, the difficult question is, the difficult question, are they aligned with the strategy 2030, particularly SDGs? Now, this brings me to the second observation. The point is, up to now, I still have difficulty looking for ADB document or guidelines on how to align this CARES lending with the SDGs. Even on alignment with the Paris Agreement, I think NGO Forum has published a number of articles questioning the failure of ADB to make ADB align with energy transformation program in order to meet the Paris Agreement goals. So what did the ADB do in relation to the early CARES applicants like the Philippines? Well, it simply accepted the Philippine loan application without using clear SDG lenses. And this loan, this a very thick document, supplemented by ADB's staff work. Some of the ADB staff are providing supplementary analysis and recommendation, usually positive in favor of the borrowing country. Now, one problem I realized while reviewing this document is that most of the ADB staff and probably the ADB official dome itself is really not fully oriented to the SDGs and Paris alignment. Now, one indication of non-alignment is that there are no clear tools yet for SDG alignment. What was happening was SDG is in the business of tagging some activities or some project as SDG aligned. It's just SDG tagging. Just like here in the Philippines, the Department of Budget and Management would tag almost half of the expenditures of the Philippines as climate change aligned or aligned with with this climate change mitigation or adaptation, more than half. So SDG tagging without any clear and measurable indications that these projects are indeed aligned with SDGs. There were also no indication that ADB has undertaken an overhaul of its traditional tools in assessing projects. Briefly, you have at the micro level, the cost-benefit analysis. If you are in economics, one of the book that they share with you is this old Litton Merlis method, popular with the World Bank, focusing on internal rates of return. The problem with this method is overly focused on benefits and that accrue to the government as the initiator of the project and to the private investor developer or the selected developer of the project, neglecting usually the broad social, economic, and environmental impact of the project. Some examples, ADB's approval of big dams without considering the social and environmental cost of this big dam. And then but they will put in the report high IRR for the ADB, the borrowing government, and the developers. And then at the macro level, so this micro level assessment or analysis is paired with the macro level policy formulation. And Susan already discussed this. Usually they end up with this neoliberal program favoring privatization, deregulation, and liberalization of the economy. So, and that's what in general is happening. I would like to see the day that they will overhaul this kind of project and program assessment and this approval system. So what's happening is that the traditional ADB assessment, this micro-macro, you have this, the ADB also came up with the 6 criteria in order for a borrowing country to merit the approval for their CARES loan application. There are 6 points. Number 1, to address adverse impact of COVID on economy. I think there's no debate. It's really a given reality. Second, to support counter-cyclical development expenditures. So some kind of a stimulus. So again, this is not debatable. That's really needed by most countries in crisis. But the third, it says there, the borrowing country must have good macroeconomic management system before COVID. And then most of those 4 countries I mentioned and the other countries that followed them in 2020, they were all given good marks by the ADB. But this is highly questionable. It depends on what do they mean by good macroeconomic management. in the case of the Philippines, the Freedom from Debt Coalition and other civil societies are questioning the claim of the government that the economy was doing well. In fact, in 2018, no less than the president Duterte said the economy was in the doldrum. But what he failed to mention is that the structure of the economy are bad. The term that we use is the economy is maldeveloped. Now, the fourth criterion, borrowing countries implementing structural reforms. And in this instance, they're referring in particular to the health reform. Again, this is questionable, and I think the discussion of Susan is right. But and in the case of the Philippines, you have a system of very bad health governance. And so 2 years after the outbreak of COVID, there's so many debates in the Philippines on how badly managed the health sector is. And then the fifth one, there's a at the last usually at the last page of the application, they discuss this debt sustainability of the borrower country. And in most cases, ADB claims that the level of debt is sustainable, and that there's no danger of default. They came up with very optimistic forecasts. But in the case of the Philippines, they said it's very sustainable, and yet in 2019, our debt to GDP ratio is 39%. Today, we're now almost to 65%. And you see the threshold warning is 60%. And I am afraid probably some other borrowing countries are in a similar situation. In other words, there was really no in-depth analysis of the capacity of a borrowing country to make their economy sustainable, including sustainable in terms of fiscal situation. And the last criterion is acceptance by the borrowing country of coordination with their friend International Monetary Fund. Why? I think you can guess the reasons, but the question is, why with the IMF? Why not alignment with the, for example, with the Economic Commission on the ESCAP, Economic Social Commission for Asia Pacific, which is monitoring SDGs. Of course, you can guess it's to ensure alignment with the neoliberal framework being pursued by these international financial institutions. Now, example of misalignment. One of the document attached to the Philippine application is a document prepared by one ADB staff, probably trying to project himself or herself as an health expert. And they came up with a so-called problem tree, analyzing the health sector. So the root cause to them of the health problem in the Philippines, insufficient financing. And so resulting into this core problem, inadequate healthcare system. So therefore, the effects of this is widespread transmission, limited capacity to treat and diagnose, increased number of people dying, and then you have this intermediate problem, limited testing capabilities, and so on, intermediate causes of resource, insufficient laboratory consumables, limited laboratories. So in sum, the whole argument is what is really needed is simply buttress the capacity of the government to finance, to provide more funding for the health sector. Now, the point I'm making is that what is missing in this problem tree is the identification of deeper problems. And some of them, again, mentioned already by Susan. You see, they forgot to mention that our health sector is badly governed. And up to now, there are continuing debates. The latest is the procurement of needed syringes so that people will have this third booster, booster. The broken health sector, the sector is broken because of past neglect, the obsession with privatization. And so what's happening, the high cost of health service, commodification of health service, and very underdeveloped government hospitals. Neglect of health sector workers, the doctors, the nurses, the health personnel. Many of them died in 2020 because of lack of attention and because of the chaotic system last year. Corruption in the health system, particularly in the health insurance system and in the procurement of health materials, and failure to implement the Health for All program, because again, this is based on the framework of commercialization and privatization. So in conclusion, it is clear that the ADB has failed to use the COVID pandemic as an opportunity to use the SDG framework as announced or proclaimed in its 2018 Strategy 2030. Had it done so, the recovery of the borrower countries like the Philippines could have been faster and resource more equitable. Right now, the health economic crisis has only deepened inequality in these borrower countries, weakened their capacity to meet these SDG targets for 2030, and rapid debt accumulation by borrowers shows that the ADB failed to forecast the digital, failed to make a correct analysis of the debt sustainability of these countries. Of course, it cannot be denied that the assistance of the ADB has helped ease the budgetary stress of borrowing countries, but only for a while. The point, however, is that the ADB has failed to fulfill its role as a development bank, particularly in its commitment to help, in its help to build a truly prosperous, inclusive, resilient, and sustainable developing member countries. Some borrowers, like the Philippines, has in fact experienced the opposite of these goals. Thank you. Good day, everybody.
Let's proceed to the next part of our program. We will be introducing our next speaker, who will discuss about a case study in Bangladesh. He is a human rights and environmental activist working as the chief executive of CLEAN, Coastal Livelihood and Environmental Action Network, situated at Pune, Bangladesh. His sector of works is climate change, mangrove and agriculture. He is also the member secretary of the Bangladesh Working Group on External Debt, a civil society platform working on mega projects financed by bilateral and multilateral financial institutions. Please all welcome Hasan Mehedi of Coastal Livelihood and Environmental Action Network, Bangladesh.
Thank you,
Hasan.
Carlo. Thank you, Suzanne and Dr. Rene, for creating a baseline for me, for a platform for me. Hope all of you and your families are safe during the pandemic, but the reality is different. All of us went through several pathetic pieces of information of either our family members or our friends or colleagues, either affected by the COVID-19 or passed away. But who cares? At least not ADB, I'm sure. So I'm sharing a brief on the study report on Cares Program conducted jointly by the Change Initiative of Bangladesh, Bangladesh Working Group on External Debt, and the NGO Forum on ADB. So the Asian Development Bank has given around $1.6 billion in this pandemic period so far to meet the challenges of COVID-19 pandemic in the country, which is around 37% of COVID-19 loans the government received for Bangladesh. Out of this amount, around $501 million has been taken for COVID-19 active response expenditure support program, which is CARES program. The program was approved by Adb Board of Directors before publishing any project document on their website. We wrote to them for detailed information, but never got the response. Before COVID-19, the debt GDP ratio of Bangladesh was 34%, which has increased to 39% during the COVID-19 period. So pressure of COVID-19 loans increased 5% of the gross domestic product of Bangladesh, which is reflected in the national budget also. In the fiscal year 2021, the debt emerged as the highest sector of public expenditure. The government has paid around $14.5 billion as debt services, which is around 24.7% of total budget of Bangladesh. One of the objectives of the program was budget support to mitigate the severe social and economic impact of COVID-19 in Bangladesh. As money has blended with the national budget in 2021, there was no way to track the destination of the finance. The Asian Development Bank didn't pay any public reporting system, put any public reporting system in place so that citizens can come to know and understand the sectors and path of COVID-19 loans, particularly the finance of CARES program. 1/5 of the total budget finance, especially bailout programs, has gone to the fossil fuel energy sector through different bailout programs, and most of the amount has been taken by private sector big polluters. So another 1/5 of the amount went to the transport sector, which is fully dependent on liquid fossil fuels and driven by the private sector again. The apparel industry received around 20% of the CARES fund, according to the media reports. This apparel industries, 90% of these apparel industries are running on fossil fuels like electricity and others. So at least 10% of the finance under CARES program has gone directly to the fossil fuel intensive sectors, and other around 9% went to partially fossil fuel driven sectors. As we don't have any access to the information, according to the media reports, only 5% of the total amount has gone to the smallholders like farmers, fishermen, or shopkeepers. Another around 5% of COVID CARES fund went to private hospitals and clinics to increase their support for the affected people. But the reality is, most of the private hospitals refuse to give any health services, even if it is not COVID-19, to the patients, even when they are not affected. At least 100 examples of people dying just outside the hospitals can be shown. Even the rich people couldn't get access to those hospitals, let alone the poor and slum dwellers. It was very traumatic to see the news every day on newspapers and television that people are refused to get basic health services from the private hospitals. Death was obvious in some cases, but denial from basic healthcare services were really inhuman and punishable. But none of them were punished. Rather, they were awarded by new fund under the CARES program. One of the objectives of the CARES program was to increase access to health services and support the frontline fighters of COVID-19 pandemic. But the health sector was found seriously corrupted, and several higher officials were taken to jail due to their corruption during the early months of COVID-19 pandemic outbreak. Fake RT-PCR tests, fake treatment clinics, and low quality testing kits and antidotes created a real mess in 2020 when the affected people wanted minimum support from the health sector. The authority forgot to pay additional allowances for the health workers who worked in the emergency, and the government forgot to pay them additional allowances after when the emergency period is over. In at least one case, the medicines and necessary emergency kits are imported from different countries. we already have come to know about corruption. The government deliberately refused to disclose the prices of kits, medicines, and vaccines. But the investigative journalists revealed that at least 7,000% more price paid for additional logistics bought for the hospitals. So the imported medicines, I already told you that the government imported some medicines. The imported medicines and emergency kits are imported in July 2020, and respective departments didn't take any initiative to receive it from the customs department even in May 2021. So all emergency kits are left in the airport for 10 months after arrival. So at least around 9 journalists and 34 other citizens were arrested because they criticized the government initiatives. They expressed their disappointment after watching all of this situation and wrote something on the social media against any of the corrupted but powerful officials. One of them, who was a renowned writer and exceptional entrepreneur, had died in the jail after tortured by the law enforcement agencies. Another journalist has lost his hearing ability due to the brutal torture of the law enforcement agencies in the custody. But we haven't seen any reflection from Adb or other multilateral institutions on the issues, although those are well reported in national and international media. There is no monitoring report available on Adb website on the update of KRS loan. So Adb is continuing its loan business without any respect to information disclosure, human rights, or basic health services or environment. Thank you very much.
Thank you very much, Hasan, Mehedi, for your presentation. Indeed, thank you for sharing on the context and exposing the realities in Bangladesh in relation to the Adb Cares Program. Indeed, there are still challenges in accessing information, monitoring projects, accessing social services, especially during the pandemic. So thank you very much. Later, we will have, once we finish our resource speakers, we will move on to the question and answer segment of this webinar. So please be ready with your questions. You can right now you can put your question, typing in the chat box if you have any for the first 3 speakers. But yes, let's proceed to our last speaker. Last but not the least, definitely our last speaker will provide discussion about the experience of India. She is a social and environmental activist who speaks up for the rights of women and minorities, as well as against systemic deprivation and land grab backed by the powerful and the state. Her involvement in voluntary civic action against an Adb-assisted project in the coastal towns of her region grew into building a movement that thwarted plans of making it a giant petrochemical hub. She coordinates Growthwatch and is the national president of the Indian Social Action Forum, a platform of 720 member organizations and movements across 15 Indian states. She is also a core group member of the Karwan-e-Mohabbat that undertakes journeys of conscience, atonement, and love on the issue of communal hate crimes across India. Let us hear it from Vidya Dinker of Indian Social Action Forum, Growthwatch.
Thank you, Carlo. Thank you. My task is very easy. Everyone who's spoken before me has actually laid out the ground, and there isn't much to add. So I had said I'd try and finish in 3 minutes flat, maybe a little more. So I first would like to acknowledge that we have a triumph even during a pandemic. The farmer movement, which really surrounded Delhi and the capital and the seat of power was besieged by farmers demanding their rights. The rollback of 3 farm laws, they stuck it. They just stood there and sat there and petitioned and fought and struggled through the pandemic, and they all made it through. So so all the fear about the pandemic seems a little unreal now that we have this big win where the government was forced to actually listen to agitating farmers that they were saying are a menace during the pandemic, and they cannot be, camping out there together and having so many protests together. But even as we celebrate sweet victory, we must not stop asking questions, because that's what the farmers told us. Do not stop asking those questions, whatever the circumstance. And therefore, in the light of the Asian Development Bank on the 25th of November, having approved another 1.5 billion loan to help the government of India purchase safe and effective vaccines against COVID-19. And the AIIB, of course, is very willing to co-finance an additional 500 million for the project. It's a time where our questions must be more pointed. And since they and our government do not seem to be really looking at the lessons learned and maybe any course correction, I guess it's incumbent upon us to do this questioning. The ground situation from India is that most of those who cannot come and push actively at the banks are deeply disappointed, they're helpless, and there's a lot of frustration because the questions put to the Indian government or to authorities around have been dealt very, very strongly with. So whether it's journalists, whether it's ordinary citizens, there have been cases filed against them, and most people have been asked to shut up. This is a time that billionaires have profited. Many Indian businessmen really made a lot of money, and while small businesses have crashed, street vendors, daily wage earners, and all kinds of people have really not made it through in terms of keeping their body and soul together during the pandemic. So we are a people really let down, not just by our government and the system, but also the NDBs who came in to purportedly help. We all know that the ADB has been very cozy with the Indian government, and the ADB and the World Bank really came in like knights in shining armor, very, very, very quickly. And they wanted to save us from poverty, starvation, ill health, or whatever. And that meant that there was no control, perhaps, on the parameters, that they must have put in place, or they should have put in place, for borrowed loans. And what we learned from our research and investigations is that the ball was dropped in the wave one itself. So the cracks were already in place, and they are now gaping holes. So, and despite prior warnings from scientists, even as early as February 2020, the Indian government did not put in place enough actions. They delayed actions and did not prepare enough. But to go back to the program that we really looked at, which is the CARES program. So ADB leads, followed by AIB, who then doesn't have to, of course, spend time and effort on doing any homework, on really processing closely or on negotiations, and can just augment the budget and come in. But where did all the money go? The government will tell you every state got a package of funds from the central scheme under the COVID emergency response to really help with exigencies of the response to the COVID pandemic, for preparedness and to strengthen the health system. Let us see how it took care of its health workers. And the primary community worker in India is the ASHA worker. So an ASHA worker is a woman who will go out into the community, and a barefoot care worker who goes into the villages, the slums, the streets, and this scheme was supposed to cover even basic things like health insurance, etc., for 22 lakh workers in government hospitals and healthcare centers, including ASHA workers. So data regarding the amount allocated or spent for this scheme was not even available. The scheme of insurance for health workers covered loss of life during the pandemic and in case of accidental death on account of COVID-19. The government had no data on the number of COVID fatalities among the doctors and other hospital staff. And the Indian Medical Association did release a list of doctors who had succumbed to the virus. That was even as early as October 2nd, 2020, but the government continued to maintain that there was no central database to provide this information. So we looked at how many claims were made under this scheme, and that might be the insurance scheme. That might also be very low. And even those who had applied for insurance, for example, we got the case of 77 health workers who were rejected since they do not meet the criteria of being primary care workers. ASHA workers, the women workers that we are still in touch with, very clearly, it's a very sadly and extremely neglected lot. They have been agitating and they have been begging, and yet they do not get the really basic support from the government to undertake this huge kind of drive of outreach in healthcare for the community. So did the CARES program really care for our care workers? We found not. To follow the money trail, we filed RTIs with the Department of Economic Affairs in the Ministry of Finance and various line ministries. That's the Ministry of Health and Family Welfare, the Ministry of Rural Development, the Department of Agriculture, Cooperation, Farmers Welfare, Ministry of Consumer Affairs, Food and Public Distribution, because as we all know, that was a big challenge during the lockdowns in India. Very limited information was forthcoming as to how the CARES money was actually utilized by the executing stakeholder departments, which made us conclude that there was a complete lack of transparency with citizens or even other government departments. So there was no clear utilization data of the loan amounts, either from the Ministry of Finance or from the executing agencies. There was very poor monitoring and implementation. Reports we accessed through government reports or the right to information were of very poor quality. And just a compilation really of press information bureau bulletins and media articles that really any citizen could have put together. And so monitoring reports in public domain have been really, really bad. What about the whole aspect of green recovery? Right. So the pandemic was a place. Sorry, have I missed any messages? No. Okay. When you talk of green recovery, you think this is the chance, right, to build back better, etc. What we found in India is that this is the time when those who wanted to mess around with the environment really made hay. So public notices for tree felling that we are still grappling with in even a city like Bangalore, tree felling for the metro project was all brought out during COVID restrictions and lockdown. So people couldn't go on board to go on site to check them out. These are also for projects that are funded by banks. The other thing that was very curious is that public hearings for really large infrastructure projects, for mining projects, for industrial projects, all these kinds of green clearances were being considered through video conference meetings. So suddenly no public hearing on site, people could not go, project affected people couldn't go and participate in deliberations, face-to-face interactions, could not put their points forth. And expert committees were giving such projects, even hydro projects in pristine forests, railway lines and highway projects through forested areas were getting their okays. Not to mention, really no-go areas or mining. For example, 4041 mining blocks were opened up to commercial interests. And so I think we have a long way. We know what India did at the COP, and what it did through the pandemic really laid the foundation for coal to continue to flourish in India, as also oil and gas. Carlo is telling me to wrap up. We're thinking that because there's been a lack of monitoring, mid-course assessments, or even the adoption of adaptive management measures, what these loans have done is provided the Indian government the license and the luxury of a continued lockdown, which really was very hard for ordinary people. It experimented on its people because it was fat on funding from the NDBs. It pushed its people into a digital economy. A lot of, Amazon and all these kinds of companies have had many more people logging and getting things home in package form. Local stores are closing down. And of course, the opening up, as I said, of no-go areas for exploitation, which is, India doesn't yet have a pandemic preparedness plan in place. There's no adequate medical infrastructure that has been created, while it had ample time between the first two waves, and whatever was created has already sort of collapsed even before the third wave that we might have coming up to us. So there's a lot to fix, lots of questions, and I hope that we can hold both our governments and the multilateral development banks accountable. Thank you.
Thank you very much, Vidya. That is a good question that you forwarded. Does CARES program really care? Based from the presentations, no, the answer is really no. Many people, especially the marginalized groups, have been pushed to the margin. Many people got disenfranchised further. So yeah, thank you very much for that presentation. And we would like to open the open forum for your questions. If there are questions from the participants, kindly raise your hand so I can acknowledge you. And if you are shy again, you can just type in your questions in the chat box so we can read it. Thank you. So yeah, maybe some participants are still thinking of their questions. So let me remind everyone that we would like to thank the organizers of this webinar, NGO Forum and Adb Coalition for Human Rights and Development, and International Accountability Project for piloting this kind of discussion. And next year we will have some more discussion, learning conversations about this topic as well. Yep. You may ask now your questions. Just type in or raise your hand. Otherwise, Jen, do you have is there any announcement that you want to make?
Nothing, Carlo, just that all the reports discussed by Dr. Engel, Dr. Rene, Vidya, and Mehedi are available on the drive that I've shared. And then I also shared the links to the COVID tracker of IAP, as well as the COVID-19 DFI tracker, as well as the toolkit tracking the COVID-19 DFI response already in the chat box. And then we have a page, the People's Tracker. If you're on Facebook, please follow, like us, so that we can keep you updated on the COVID loans being made by ADB and the IIP.
Thank you, Jen. Yeah, please do access the links that are provided by Jen in the chat box, so you can have a copy of the presentations from our resource speakers, and of course the DFI COVID-19 DFI tracker.
I had one question, Carlo,
okay.
just
Yeah.
as I think a nice way of finishing up. I'd love to hear from each of the panelists as to what their top recommendation would be for the ADB and the other development banks to address some of the problems that have been identified. Like I could start that, you know, I would love to see them immediately suspending their support for private healthcare provision as my top priority. And I'd love to hear from the other panelists.
Thank you, Susan. Yeah. Who wants to go first? Maybe Dean Rene, you want to go first to answer the question posed by Dr. Susan?
Hey, Professor Susan, you're raising a difficult question. Anyway, based on my presentation, really, the challenge I'm making to ADB is that it is not enough that you have this rhetorics on sustainable development, energy transition, but they should come. I think NGO Forum has been raising a number of issues related to the capacity of the ADB to walk the talk. But in relation to the topic I just discussed, the challenge that I'm making to ADB is they should overhaul their whole system of assessing projects and make them really align with what they say as SDGs, or support to sustainable development. I mentioned in particular these twins at the micro level. They have this little Merlisa type of cost-benefit analysis, but they overly focus on the perspective of the technocrats, on the perspective of the private developer, neglecting the importance of measuring the social cost, the social returns from the perspective of the people affected. And we have seen that in the case of numerous projects related to big dams and so on. But at the macro level, they're still, they don't say it, but their default on any issue of growth and development is very neoliberal. They talk immediately of to grow the economy, you have to open up, to privatize, to regulate. So these are the twins. So to me, these are not consistent. These are not aligned with this program of SDGs and making Asia sustainable. Thank you.
Thank you, Dean Rene. Who wants to go first, Vidya or Hasan?
I can.
Mehedi,
Shall I?
Sure, yeah. Go ahead, yeah.
I mean, really, a pandemic is a time that, you know, you sort of reevaluate everything around you. And that was our hope in the beginning. And but we have seen that for the banks, it has been business as usual. In fact, business has been even better during the pandemic, and they've actually supported governments to continue as before and be more draconian with their own people. So I think this is the time to do some soul searching, to come up with papers. Each MDB should actually re-evaluate what happened during the pandemic. What did they, even if unwittingly, support, come out clean, and then look at course correction measures. Because if we are talking of new beginnings in the post-pandemic scenario that we are already in a way in, and sustainable social and economic development, these gaps that we have seen in their projects up, it just cannot continue. Things like this cannot continue. So they have to see that the pandemic funding actually is laid out for what it actually did on the ground, so that there is prioritization on things that are ecologically sound and socially and economically also just. And this, I do not think we should allow them to escape with. We will have to work much harder to see that they are accountable, and ask for, what's it called, a white paper, ask for white papers and hold them accountable. Yeah.
Thank you very much, Vidya. Hasan, you want to answer the question?
I think he's had to leave us, Carlo.
Yeah, he left already. Yeah. So thank you. Thank you again. I think there's no more question, no? In the chat
There's only the
box.
question of pushing for reparations.
Yeah. Yeah, I agree. Yeah, thank you very much, Vidya. Thank you very much, Dean, Rene, and Susan, for your very insightful sessions. No, thank you very much also to the participants who stayed with us through this or throughout the conversation, and we hope to see you again in the next series of our webinar on this. Thank you very much to NGO Forum and Coalition for Human Rights and Development for organizing this kind of space where we can learn from each other and forward our demands. So thank you again, and I think this is a good holiday for everyone. Thank you.